Good morning, Mr. Secretary. You've been asked about the huge increase in illegal child labor by migrant children. Here's the New York Times story headline: As migrant children were put to work, U.S. ignored warnings. Subheadline: The White House and federal agencies were repeatedly alerted to signs of children at risk. The warnings were ignored or missed. Now, you've testified that that these children are being exploited by unscrupulous employers, is the term that you've used. And you also mentioned that some of this is outside your jurisdiction, which is fair enough. So maybe as a point of common ground, can we agree that we haven't done enough, or specifically the Department of Labor needs to do more to crack down on these unscrupulous employers? Do you agree with that?
I'm certain that the Department of Labor would tell you that they love more resources to go out and do the oversight and enforcement work to make sure kids are not being abused in
So as it is, they haven't done enough. You'd agree with that?
I'm sorry?
You'd agree they haven't done enough as it is?
They've done a great deal with the resources they have.
I see. There's been a 70% increase in illegal child labor. Does that mean is there 70% less staff right now at the Department of Labor? I'm trying to understand why this is a resource question.
My suspicion is if you look at their budget to do the oversight and enforcement, it's not grown to meet the needs.
I see. Thank you. Mr. Secretary, did forcing 2-year-olds to wear masks save lives?
Do what now?
Did forcing 2-year-olds to wear masks save lives?
Making sure people wore masks when it was appropriate was essential to make sure that we were able to get out of this pandemic.
Sure, but that wasn't my question. Could you answer the question that I asked?
Which is?
Did forcing 2-year-olds to wear masks save lives?
And who did the forcing?
Well, your department, or the Head Start, which is under your department, had a mask mandate until late last year for 2-year-olds and above, even outdoors. So can you point to any public health benefit of that policy?
Right. We never forced anyone to do anything because we don't have the jurisdiction or authority to do that. What we did was provide guidance on what would be
Mr. Secretary, did Head Start have a mask mandate?
We provide a mask mandate, a requirement for jurisdictions that wish to receive money to provide particular services.
So Head Start did have a mask mandate for kids, yes?
We had a mask mandate for for agencies that wish to get federal dollars.
So that's a yes. So can you point to any benefit,
that's not a yes to
any
your
public
question.
health benefit from that policy, whether it was recommended or enforced or forced, of requiring young children to wear masks?
Did families benefit from the policy of using all protection, all precautions to avoid
No, I'm not asking you to
COVID?
rephrase my
Yes.
question as some abstract question that you'd rather answer. I'm asking that you, as the person who's the Secretary of Health and Human Services, right now, can you point to any evidence that there was a public health benefit to forcing young children to wear masks?
Well, the fact that today we are not losing lives the way we lost them when we first got into this pandemic.
And you think that's
is a
because we
clear
forced
sign.
2-year-olds to wear masks?
That's your interpretation. What I'm saying to you is that using good policies that give us the precautions to keep our families from contracting COVID are helping save lives.
I want to quote you from an article from NPR in January of 2022. It says, "The United States is an outlier in recommending masks from the age of 2 years old. The World Health Organization does not recommend masks for children under age 5, while the European equivalent of the CDC doesn't recommend them for children under age 12. In retrospect, was it a mistake for the United States to defy the international norm on child masking?
The U.S. has been working closely with our international partners, and we have done more than any other country to try to help.
But that's not what I asked you. I asked you, was it a mistake to defy the international norm on the issue of child masking?
We continue to use all the best practices when it comes to making sure people take the precautions.
Is there a reason you're not answering my question, Mr. Secretary?
I'm answering the question the best I can because you keep phrasing questions that are already geared to get a particular answer.
Mr. Secretary, a few weeks ago, we had the testimony from your counterpart, the Secretary of Education, who gave false testimony to this committee. He claimed that he did not encourage states to adopt student vaccine mandates. I wanted to ask your own recollection of your own advocacy. Did you encourage or support the adoption of student vaccine mandates by states or school districts?
We have encouraged states to use all the precautions necessary to protect their populations, including students.
Did you, including student vaccine mandates?
All the precautions to help states protect their populations,
right, but specifically,
students.
did you support student vaccine mandates?
We have supported all the policies that show that they help save lives.
Did you support student vaccine mandates, yes or no?
We have supported all policies that help states make sure people's lives are saved.
Mr. Secretary, Madam Chair, I think we had an opening from you asking for the witness to give frank and honest answers, and we're just not getting that today, I'm afraid, and that's very unfortunate.
Congress, if you pose questions in a way that I could respond to them, I would.
Thank you, Mr. Kiley.